Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Lagos State Commissioner for Health, Professor Akin Abayomi, tests negative to COVID-19 after 9 days of isolation and treatment. Presidential Task Force on COVID-19 cautions on the need to be vigilant on the safety measures and coronavirus guidelines. And global coronavirus cases surpasses 25 million with more than 846,000 deaths, according to the Johns Hopkins Coronavirus Resource Center. We begin in Africa, where the coronavirus now stands at over 1.2 million, while total deaths are at almost 30,000. The number of recoveries is nearing the 1 million mark. According to the Africa Center for Disease Control and Prevention, Central Africa has 53,665 cases. It has recorded over 1,000 deaths and 43,437 recoveries have been made. Cameroon has the highest with over 19,000 cases. Over to Eastern Africa, which has recorded 133,104 cases. It's recorded over 2,000 deaths and over 72,000 people have recovered. Ethiopia is top in that region with 51,122 coronavirus cases. North Africa, where you have countries like Algeria, Egypt, Libya, Morocco, has recorded over 200,000 cases. Its death toll is at 8,479. It has discharged over 158 persons. Egypt, where the first confirmed case of COVID-19 on the continent, has cases at 98,727. Southern Africa takes a larger chunk of the continent's portion with 670,084 cases. It's recorded 15,015 deaths and made over 500,000 recoveries. You have South Africa in that region, whose cases stand at 625,056 cases. Now, West Africa has recorded 159,960 cases. Its recoveries are at 132,784, while the death toll is 2,386. Now, in Nigeria, the Nigeria Center for Disease Control last night announced 138 new confirmed cases, its lowest in months, and 2 deaths were recorded in the country. The cases were reported from 13 states, and the FCT and Plateau states recorded the highest daily figure at 55, followed by Lagos with 15 and other states. Now, 199 discharges were reported in the last 24 hours in 11 states. Plateau recording the highest recoveries at 46, Bauchi 31, Abia 28, Kaduna 27, 20 in Ondo, 18 people recovered in Ekiti, 9 in Anambra, 9 as well in Rivers, 7 people recorded in the FCT, 3 in Osun and 1 in Ogun State. The 2 deaths were reported from 2 states, 1 in Abia and Osun states. Till date, the total cases confirmed in Nigeria stands at 53,865, with 41,513 cases discharged in the 36 states and the FCT. Now, there's some good news coming from Lagos State today. The Commissioner for Health, Professor Akin Abayomi, who tested negative to COVID-19. In a tweet today, he shared the good news of being back better and bouncing after testing negative to COVID-19 infection after 9 days of isolation and treatment. He thanked the entire members of the Executive Council of Lagos for the overwhelming support and outpouring of love throughout the period of his treatment, saying further that encouraging messages from well-wishers sped up his recovery process and made the COVID-19 experience less challenging. Professor Abayomi also says that he is grateful to God for the tremendous progress the state is making in the fight against COVID-19 in the state, saying that he is glad the numbers of infections are declining by the day. He also urged Lagosians to keep observing the necessary COVID-19 regulations in public spaces and remain vigilant at home. Now, the Presidential Task Force on COVID-19 in its briefing today cautioned against dropping the ball in the battle against the pandemic. The chairman of the COVID-19 Task Force and Secretary to the Government of the Federation, Mr. Boss Mustafa, says although it is heartwarming that Africa is recording the lowest number of global coronavirus cases, Nigeria should not lose its guard on taking the necessary steps to curb the spread. He says the committee welcomes the call for reopening of schools, but that Nigeria is learning from the experience of other countries where reopening led to an increased number of confirmed cases.
For us in Nigeria, the last 3 weeks have shown a slowdown in the number of confirmed cases. Indeed, in the last 4 months of testing, the lowest daily figure of confirmed cases, 138, was reported on the 30th of August 2020. The PTF still urges caution and vigilance on the declining numbers because the virus is still potent and very dangerous. This position is informed by the fact, in spite of our enhanced testing capacity, the number of samples collected for testing have not been very encouraging. As we plan to reopen more sectors, we must stay the course and stick with our winning strategy, which is anchored on the ability of our health institutions to contain the virus, while we as citizens wear our mask properly, stay away from crowded places, avoid mass gatherings, maintain simple hygienic practices, and as much as possible protect the elderly and most vulnerable to this pandemic. It is in the above context that the Presidential Task Force appreciates the ongoing calls for reopening of the education sector, and indeed some subnationals are already making preparations for such. Whilst the PTF does not discourage making such preparations, we need to be guided by experiences from countries such as Germany, France, the United States, and the UK, where opening of schools in some cities led to an increase in confirmed cases and fatalities.
The Minister of Health, Dr. Osage Hanire, the committee is worried about a huge number of persons attending campaign activities, which he says creates a risk of infection.
We are beginning to see a situation where the number of those treated and discharged exceeds the number of positive cases detected. And while these figures may seem reassuring, they may be deceptive, and we cannot assume that the curve is flattening. Since we are yet to perfect due diligence on our side, testing has, for example, dropped quite significantly due to reduced sample collection across many states for reasons that are not clear in all cases. One state, for example, tested over 35,000 in July and less than 20,000 in August, while another dropped from 23,000 in July to about 4,000 in August. Among the challenges will be the reason for us to worry about states where elections are contemplated, and campaign activities have led to a lot of frenzy and movement that create the risk of infection, while testing in these areas may decrease due to distraction.
Joining us from our Abuja studios is Dr. Anzaku Peter Joseph, a pharmacist, public health expert. Thank you for joining us on the program.
Thank you.
Mr. Joseph, it's a lot of It's a lot of revelations from the Presidential Task Force on COVID-19 about the virus today. Apparently, testing is still a challenge, and we are far from the target of 2 million tests. How would you assess the response to scale-up testing?
The response has been very, very enormous, very, very interesting, and also look at it from the perspective of the political will that as of July 30th, from our last presentation, remember that I came here, had another update on COVID as of July before the 30th, and the NCDC promised us one thing, that by 30th, they'll be able to have what we call 2 million test kits. That is, 2 million samples will be tested. Now, as I'm talking to you, we only have 352 test kits so far released and tested, with 403 samples, and maybe 347 samples were tested. That shows, and I'm looking at a population with a current projection of 205 million, which means it's not enough. It's not effective. With this, we're able to understand that we're still battling with the issue testing, particularly test kit and sample testing is a major challenge. And I want to encourage the NCDC, despite the paucity of funds, and also encourage the federal government to adopt some strategic measures where they can engage and involve the state government to do more on the aspect. And I want all the state governors to learn, to take a cue from what Lagos state government is doing. As of last week, they've accredited about 10 laboratory centers, test centers. That's to show that is a personal effort by Lagos state government. These are experts. These are certified laboratory technology scientists, or scientists precisely, who can go, they have all the technical know-how to give us correct and accurate testing of COVID-19. Now, what we are talking about is we are faced with the challenges of the post-COVID-19 era. What I mean by era is that schools are about to be resumed, which means schools are resuming. 2, the international flight is resuming as of maybe by 4th September. Schools are resuming by 21st September. And Lagos State is resuming its own schools, that is tertiary and secondary, all resuming on 14th. You can look at this. This is an avenue for the federal government, avenue for the NCDC to mandate compulsory testing, to make available the testing kits. Every pupil, every student, whether at secondary school level, whether at secondary school or tertiary institution, should be tested compulsorily. And that will even help us to generate genuine data. Nevertheless, also on the issue of international flight, we should make COVID-19 certification mandatory. Just like we were having yellow fever vaccine and other vaccines. Before some countries who are endemic to this diseases, without certification, without the vaccine certificate, you can't travel to those countries. And therefore, whether you are coming into the country, you are going into outside the country, let's make COVID-19 mandatory. The testing should be mandatory. That should even make the available kits, testing kit, they should make it available so that we'll be able to generate our genuine data. Up to now, we don't have genuine data. We don't. Some state government governors even hamper the process. They refuse NCDC to operate openly, to operate smoothly. And therefore, the entire process has been helpful. So we can't even say this state government, this is the real confirmed cases in that state. Those are issues that is complicating the situation. And therefore, for us, mandatory testing using the test kit as well as sample testing, otherwise, and the accreditation of more labs. I'm also happy from the presidential panel, their own briefing, the task force, the COVID task force from their briefing. I'm aware now that some funds were even made available to the state governors. I think they should take a cue from the Lagos state government where more labs will be accredited, testing kits will be made available so that we can test people. Like schools now, it should be mandatory that all students resuming should be tested. I think that will help us to curtail the spread of this infection. Of course, I also agreed with the Minister of State, the Honorable Minister. He said something. We shouldn't assume that the curve has been flattened.
All right.
And I agree with him. It has not been flattened. We have a peak in that curve as of July. As of August, it marginally dropped. It has not been flattened.
Essentially, Dr. Joseph...
coming with 15 people, only 55 people again, new confirmed cases, which is on the high side.
It's
Lagos
not yet
has dropped.
I wish we had more time on this issue, but I'd like to thank you. Thank you so much, Dr. Joseph. Thank you for joining us and throwing more light, your insights on this very important issue. Thank you. Well, we're going on a short break, but just before that, let's show you some of the sights of the Commissioner for Health, Lagos State, as he walked through the isolation treatment, of course, of COVID-19, where he was also thanking members of the Executive Council of Lagos for the overwhelming support and outpouring of love throughout the period of his treatment. We'll be back with more updates when we return. Stay with us. Let's go over to Imo State, where our correspondent Eita Kwekute brings us this COVID-19 update.
We are at one of the most popular secondary schools in Owerri, the Imo State capital. It's the Owerri City School. We are here to monitor the level of compliance of the school to the COVID-19 protocols as students in exiting classes continue with their WAEC examination. To a large extent, the level of compliance here is commendable. Right from the gate is no face mask, no entry for students, and there are enough points to wash hands with soap, with strict adherence to social distancing in the classes. According to the management of the school, they have over 300 students registered for the WAEC examination, and so far, none has tested positive for COVID-19.
We have not had any problem. We have been using our thermometer to make sure that we check the temperature. We have not gotten any student that has that temperature expected. Then we have this room, waiting room. Then we have our sick bay. So, which we have these things ready. But luckily, we have not gotten any case. We normally keep somebody at the gate. So it is compulsory that you must, even you see what is written there, no face mask, no entry. So even outsiders, you must put on your face mask first. Then when you come in, we have teachers at the gate who ensure that you must comply by washing your hand, using sanitizer. We make sure that our students have their own pocket sanitizer, all of them. If you don't have it, we won't allow them to enter the hall.
According to the school management, they have at least 1 week till the end of the WAEC examination, and they are hopeful that it will be a smooth ride till the end, as no student or teacher will test positive for COVID-19. From Owerri, the Imo State capital, Eita Kwekute for COVID-19 updates.
According to UNICEF, the closure of Nigerian schools amid the COVID-19 pandemic led to more than 50 million children remaining at home, with an education system already burdened with low participation and learning achievement. The closure increased the challenge for children's education and with the potential to set back recent gains in bringing children back to school if adequate action is not taken. The report also revealed the limitations of remote learning for those children who do not have access to the necessary technology and for those in countries that did not respond adequately to the situation. We have joining us right now Dafe Ojebwe, a medical scientist. He joins us via Skype from Calgary, Canada. Thank you for joining us on the program.
Thank you for having me.
I'd like to begin with your assessment of how the Canadian government is fighting COVID-19.
Okay. The Canadian government has done a lot in regards to this pandemic, most especially in the cases of sample collection and testing. But before I delve into that, the Canadian government has actually invested a lot of dollars in terms of getting state-of-the-art equipment to ensure that the sample collection process and the testing is efficiently and effectively run. And also, the U.S. border with Canada has been closed. As of yesterday, the border has been closed and extended for like 1 more month. So the border will be open September 30th. So in such kind of cases, the government has preventing inflow of people from US, because if you actually look at the number of cases from the United States, you will see that the United States is not actually managing this pandemic very well compared to the Canadian government. So the Canadian government has invested a lot of money when it comes to that of fighting the pandemic. So those are some of the responses that the Canadian government has done.
You compare that to some of the efforts in Nigeria, you might say that we are behind, especially with some of the revelations today at the PTF, sample collection and then our testing, seeing as we're recording lower numbers of the virus. But let's look at schools responding to the preventive protocols and what you've observed in Canada and what you think Nigeria can learn as international flights resume and schools as well fully in the future.
The sample collection process in Nigeria is still on the low ebb because from the NCDC website, as of yesterday, the number of tests that has been done in Nigeria is just 402,017 tests. And Nigeria is a population of over 200 million Nigerians. And in Canada, we have done about 5.4 million tests. And Canada just have a population of about 38 million persons. If you do a percentage of the number of tests that has been completed in Canada compared to Nigeria, you will realize that in Canada, the percentage is 14.3%, while that of Nigeria is just 0.002%. So that is grossly inadequate. So what I think the Nigerian government needs to do is to show up their sample collection process, most especially now that students are going back to school very soon. The teachers should be tested before resumption, and also the students that are returning back to school should have availability to these tests. So with all these things in mind, I think these things are going to increase the number of sample collection process that is going to take place in Nigeria. And also, as the SGF was saying, if you go to most rural communities, they don't have a lot of enlightenment about these COVID cases. So I think a lot of enlightenment needs to be done. You know, we need to go to our native languages, take this message to our people back home, Hausa, Yoruba, and the various languages, and explain to them what this is all about. Because you will also agree with me that people from rural area are coming to the cities. And if the people in the rural area are not taken care of, the number of cases in the urban area is going to be increased.
All right. Dr. Joey, thank you so much, medical scientist from Calgary, Canada. Thank you for joining us on the program.
Thank you so much.
Now, global cases of coronavirus surpassed 25 million, with more than 846,000 deaths. Figures from the Johns Hopkins Resource Center shows the United States approaching 6 million total coronavirus cases, with 183,083, the world's highest death toll.
According to the Center for Systems Science and Engineering at the Johns Hopkins University, the number of COVID-19 cases in the United States is only inches away from 6 million. The country has reported over 5.9 million confirmed cases nationwide as of Sunday, while the total fatalities reached 183,057 as of late Sunday. The worst hit areas are California, Florida, and Texas. Meanwhile, the cumulative number of COVID-19 infections in Latin America is close to 7.25 million as of Sunday, with over 3.86 million cases reported from Brazil, the second most affected country by the pandemic, only behind the United States. By Sunday, Brazil had reported over 3.8 million confirmed cases. The national death toll of COVID-19 reached 120,828. The Argentine Health Ministry says a total of 408,426 COVID-19 cases have so far been reported nationwide, with 8,457 deaths. And in Asia, India's COVID-19 tally rose above 3.6 million, and the death toll rose to 64,469 as of today. As many as 78,512 new cases and 971 deaths were recorded over the past 24 hours, the fifth consecutive day when the COVID-19 cases have increased by more than 75,000. There are still 781,975 active cases across the country, and more than 2.7 million people have been discharged from hospital. Across Europe, schools are preparing to reopen, and plans to reopen schools are under pressure as cases continue to rise in Spain, where classes in most regions are set to begin first week in September. Although schools in some regions like Murcia, Asturias and the Canary Islands have delayed their start dates to the second week of September, students in the Basque, like in the Madrid region, will return the first week of September.
Just as the vast majority of Victorians are doing the right thing, and that's central to this strategy working.
Finally, the state of the epicenter of Australia's second wave of COVID-19 infections says the number of new cases fell to a near 2-month low, allowing authorities to detail in a week's time how stringent lockdown measures will be lifted. Victoria said it had detected 73 new cases in the past 24 hours, the lowest since July 3rd.
Take a look at our website, channelstv.com, for more updates on the pandemic. You can also find other stories in health, politics, business, sports from Africa and around the world. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy and stay safe.